Welcome, everyone. I'm Don Gibbs, the CEO of the Skoll Foundation, and one of my greatest privileges is to participate in convenings like this that provoke us to think critically and act urgently to address the biggest challenges of our day. The COVID-19 pandemic has exposed the inequities and weakness of unjust and unsustainable systems globally. This has been especially true in the US. There are few statistics that really bring this to life. In the US, Black adults between the ages of 35 and 44 are 9 times more likely to die from COVID-19 than white adults. Native Americans are 8 times more likely to die than white adults. The pandemic has made it glaringly clear that we may all be in the same storm, but we're not in the same boat. These disparate health outcomes are deeply rooted in structural racism and historic injustices. Today, we'll hear from some of the leading researchers, activists, social innovators working at the intersection of racial justice and the COVID-19 pandemic. I'd like to give special thanks to our convening partners, NDN Collective and New Profit, for their engagement and collaboration on this event. We're blessed to have them as partners, and it will take all of us, shoulder to shoulder, working together to address the challenges we're discussing today. We'd like to share a short video featuring poet Darius Simpson to help set the tone and offer some context for the discussion that comes ahead.
COVID-19 shook the world to its core, or kicked up a familiar dust, or coughed up what's been resting in the diaphragm of the United States for centuries. Coronavirus broke headlines as a global pandemic, while 2020 was still getting its bearings. You might think, in a time of social distancing, while many of us face an issue that is incapable of discriminating, that we are finally in this together. Yet, there are communities who are more drastically impacted, even by a virus that promises nothing except that it is equally contagious regardless of skin color. Perhaps a virus need not discriminate if the humans it is infecting have created systems that do the discriminating for it. If we are advised that our safest place is inside, then what of the people without an inside? If we must distance from even family, then what of the families who live in no-bedroom apartments stacked on top of each other? If school has moved from classrooms to the kitchen table, then what of the students without kitchen tables?
I had one shift where I saw about 84 patients.
The first 21 days.
Maybe this virus has illuminated an age-old inequity in this country, with mortality rates 6.7 times higher for Black people, 4 times higher for Indigenous folks, 2.5 times higher for Latinx humans, and 2.6 times higher for Asian and Pacific Islanders. Perhaps now is not the time for answers, but for questions. Like, how might we even the playing field? Where are the gaps and needs? Which humans have access to which healthcare? Who can afford to work from home? Why are essential workers being called heroes but not being paid like heroes? What will happen when they are no longer considered essential? What if we acted in solidarity with our most vulnerable? What if Black and Latinx people didn't comprise 56% of the prison population? What if there was no prison to populate? What if no one was disposable and a virus couldn't recycle itself in the imaginations of the rich? And what if we just stopped for a second to consider all the sickness that existed before, to consider how we might start healing those systems, to consider the color of COVID?
Let me now have the great pleasure of introducing Cheryl Dorsey, president of Echoing Green. We're so proud to have invested in Echoing Green's Racial Equity Fund that leverages social innovation to dismantle structural racism and build inclusive economies. The fund will launch and scale 500 social enterprises focused on racial equity and break down barriers to capital that social entrepreneurs and innovators of color face globally. We see it as a critical investment in the next generation of leaders who will help dismantle the root causes of racial inequity and injustice. I'm also happy to say that Cheryl is the newest member of the Skoll Foundation board. She's been a teacher of mine for a long time and brings a wealth of wisdom to how to drive true transformational change through social innovation. As Skoll continues its journey working with proximate social innovators across sectors to help advance racial justice and equity, I can't think of a better leader from us to hear from. Cheryl, over to you.
Thank you so much, Don. Really appreciate those kind words. Also want to send a big thanks to the entire Skoll family, Jeff, the staff, the entire board. It's been an honor to begin to work more closely with you all, a true honor, especially in this moment. Also want to thank our convening partners, New Profit and Indian Collective, and to all of those who joined us today for this important conversation. And I must say, greetings from Washington, D.C., a rainy Washington, D.C. But to open, I would like to humbly make a land acknowledgement. I would like to start by recognizing and acknowledging the indigenous people of the land where I now sit, the Nacotchtank. The name is derived from the word Inakwashatanik, meaning a town of traders. And I know that while a land acknowledgement is not enough, it is an important social justice and decolonial practice that promotes indigenous visibility and a reminder that we are all settled on indigenous land. Let this land acknowledgement be an opening for all of us to contemplate a way to join in decolonial and indigenous movements for sovereignty and self-determination. And as we turn to our discussion now, if you'll indulge me, a few housekeeping notes. I'm going to ask that everyone remain on mute to minimize background noise. Please feel free to enter your questions for all of our wonderful speakers using the Q&A box on the bottom of your screen. Please note that our speakers may refer to references during their talk. Someone is going to link them in the chat feature, so please be on the lookout for those materials. And of course, feel free to chat in real time with other audience members in the chat box on the right. We may be virtual, but we're here together and we're in conversation. Representatives of each of our convening partners, as Don mentioned, are here with us today and will now say a few words. First, would love to hear from Tulane Montgomery and then Nick Tilson.
Thank you so much, Cheryl, and so good to be here with all of you tuning in from all over the planet to have this important and timely conversation. My name is Tulane Montgomery. I'm managing partner of New Profit. We are so proud and honored to be convening partners with Skoll Foundation and Indian Collective. And I just want to offer a quick note. So New Profit is a philanthropy, Skoll is a philanthropy, Echoing Green, and I want to offer a little reminder of the roots of philanthropy. If you look into the etymology of the word philanthropy, it means to love humankind. And I want to offer that as a reminder and a frame for this conversation, because when the stakes are as high as they are today, when the fight is as serious as it is right now, sometimes talking about love can feel like a cop-out, right? But I would offer that love is not for the weak-willed or the simple-minded. Love requires bravery, courage, clarity, honesty, and genius. And so we're going to have this conversation with the intent that we will gather enough information and answer and unearth the questions that enable us in philanthropy to really lead with love as the impact that we have. And so I'm so excited to be here with all of you today and look forward to this conversation. It couldn't come at a more important time.
Hamadakyapi, Nick Tilson, Amachiapi, Shantea Washte, Napechuzapalo. My name is Nick Tilson, greet you in my Lakota language. I'm the president and CEO of the Indian Collective. Indian Collective is honored and excited to be partnering with New Profit, with the Skoll Foundation. Some of these relationships are really new over this past year. And so we're honored to be here having this very important conversation that we're going to be having. And I think that, you know, the part of the poem you got to hear at the beginning was that this crisis that we're in and this pandemic that we're in has uncovered and unearthed systemic issues throughout our communities and throughout this country, and really hitting at the core of the challenges that we're faced with. And so, Indian Collective as a national organization dedicated to building Indigenous power and changing the conditions in which the way Indigenous self-determination is supported, is honored to be partnered in having this conversation. You're going to be able to hear from Eric and other Indigenous leaders in having this fruitful conversation about not only the struggles that we're in today, but where we could be going and how we can actually collectively be building power, solving problems, and leaning in towards collective liberation in the future. So we're honored to be partnered, on this event, and honored to be pivoting at this time in history, because I think that many years from now we would look back at this time in history and we'll be asking, what did we do? What did we contribute to that time? And so here we are. So honored to be here and have a good session, everybody. Doksha. Okay.
Tulane, Nick, thank you both so much, and raising up concepts of both love and crisis, right? Because Nick, you're right. We are in a moment of crisis in this country. Today we are going to surpass 9 million cases of COVID-19, and we will have lost almost 229,000 of our fellow citizens by this evening. The epidemic is getting worse in 47 of 50 states, and we lost more than 1,000 souls yesterday alone. The death rates are rising again. Professor of history and history of medicine, Frank Snowden, said, "To study pandemics is to understand a society's structure, its standard of living, its political priorities. The disproportionate impact of COVID-19 on people of color, the higher burdens of cases and deaths, is an indictment, and one that elucidates the impacts of structural racism on communities of color." That's what we're here to talk about today. Let me start by welcoming our first speaker, Dr. Mary Bassett, to talk more about these racial inequities and their drivers after she introduces herself. Dr. Bassett?
Thanks very much, Cheryl. It's such an honor to be here. I want to thank the Skoll Foundation, and I'm so pleased to be here with all the other panelists. So I'm Dr. Mary Bassett. I direct a center called the Francois Xavier Bagnoud, or FXB, Center for Health and Human Rights at Harvard University. And I have a long-standing interest in racial disparities in health. We've heard the numbers, and I feel that I should begin, as others have, and hailing you from Massachusetts, where I'm on land which was previously occupied by the Wampanoag people and others. It's hard for us to remember in our daily lives because this population has been so reduced that there are 600 federally recognized and other indigenous groups who have survived and are among us still. So we have been looking at the early emergence of racial disparities in COVID mortality and case rates. And it's shown as what everyone's already heard, that it's abundantly clear that this country, the wealthiest and one of the most medically advanced countries in the world, has utterly failed to control this pandemic. And the vulnerabilities pre-existed COVID-19, pre-existed the current administration. And we're seeing huge gaps. So among Black people between the ages of 35 and 44, our research shows a 9-fold increased risk of death. This increased risk in young people is related to everyday life, not to inadequate bodies. It's related to people who are still working, people who are still traveling on crowded transport, people who are going home to crowded multi-generational households. And we need to talk about that before we start talking about the problems of diabetes and heart disease.
Dr. Bassett, can you talk about some of the data that your organization have collected, and then can you sort of unpack what that means? And then we only have a few minutes with you. Some of the policy solutions that will help us sort of cross over to the other side of this.
So as you know, the best sort of data during this pandemic has been coming from journalists, particularly the print media. And this is an indictment of what's happened to our public health authorities. The CDC has been effectively muzzled. And we learned in March of the excess African-American mortality. The data weren't available by race from the federal government, but when they became available, we analyzed them. And they show what you've already heard: 3-4-fold times higher risk of death, and much extremely high risk of death among younger adults who are Black, Latinx, and Indigenous. Now, it's important to interpret these data correctly. The fact that they are so large, that they emerge so quickly, suggests that they're structural in origin and they need structural solutions. People often say we can't do these, they're too complicated. They mean things like having paid sick leave, health insurance, affordable housing, addressing the longstanding inadequate access to the labor market and the access to living wage for people of color. And these are things actually that the private sector may be more agile at addressing and should figure out that this is worth their while to address, because the cost of not addressing it is paid in human lives.
No, I appreciate that, Dr. Bassett. And I've heard you say that we've got to move beyond the individual to the structural, and sort of laying out some of these policy prescriptions is quite important. But, you know, I appreciate you as a researcher, as a clinician, but also as a moral agent that's bringing a sense of urgency. I know that you've done some work with Reverend Dr. William Barber, who's co-chair of the Poor People's Campaign. And I was rereading a piece you all co-authored in June for The Nation called "Systemic Racism is Social Dynamite." Tell us more about your work together and what you mean by this.
Well, we just had a convening with Reverend Barber and his co-chair of the Poor People's Campaign. And as you know, they focus on the problem of systemic racism, poverty, our ecological destruction, and more. And before we wrap up, I gotta ask you to back up so everyone can see your T-shirt.
Can you
Barber
see
would
it?
ask me to do that. No, we can't.
I'm gonna stand up a little bit.
Stand up. Thank you.
That's right. Thank you, Dr. Bassett.
These are issues where we each have an individual role, but for too long, academics, people in public health authorities have been reluctant to talk about the true underlying facts that drive this vulnerability and mean that this wealthy country is accounting for less than 5% of the world's population, as over 20% of the world's cases and rising. So Reverend Barber talks about this, talks about the cost in the death, so how we interpret death numbers and understand what lies behind them. These are policies which have enabled a tiny fraction of our society to become incredibly wealthy. 3 people controlling the wealth, and we know their names, of half of the population is incredible. And those have a cost in death rates. So he asks us to go back. And he challenges us, and I'm proud to have been able to join him in making those challenges. So everybody should go to their website and take a look. We need data. We can't see what's going on without data, but we also need to have movements. And these are movements that should involve not only people of color. These are movements that we need to protect all of us. And so that's my view on all this. It seems out of my lane as a public health expert, but it's we all got to get out of our lane because COVID-19 is on the open highway.
No, though I appreciate that, Dr. Bassett, and I appreciate sort of the intersectional, intergenerational, interracial nature of this conversation. And as the Reverend Barber talks about, sort of the need for the moral revival that is called for in this moment. And I appreciate you. I'm sorry we don't have more time, but you have teed up our next speaker perfectly, Dr. Bassett. So thank you so much.
Thanks
and let me so much. Really appreciate you. And I will turn to your fellow clinician now, Dr. Eric Brote. a tribal health and inpatient COVID provider. Dr. Broad, after you introduce yourself, can you talk about how the COVID crisis is playing out in your community?
Oh, good morning. Thanks for the opportunity to be here. I just want to start first by acknowledging the original inhabitants of the land that Oregon Health and Science University is built upon and occupying. I acknowledge the Multnomah, Cathlamet, Clackamas, Tumwater, and Watlala bands of Chinook. I acknowledge the systemic policies of genocide, removal, relocation, and assimilation that have and continue to impact Native communities to this day. And I also want to acknowledge that we are all here because of the sacrifices forced upon them. I work at Oregon Health and Science University. I'm a family medicine provider. I practice inpatient medicine at a large academic health institution as a COVID provider, but then also work in a tribal health clinic in rural frontier central Oregon. And then I also lead and direct the Northwest Native American Center of Excellence, which is an educational initiative that believes in the power of Indigenous youth and believes in the wisdom that we have in our communities to solve some of the most pressing challenges that are facing the world today. And what we aim to do specifically is to increase the number of us Indigenous people who are working in the health workforce and can become the future health leaders of tomorrow. You ask an excellent question, and I think that it's been alluded to in the introductory remarks. It was alluded to in the short clip of the video. It was also alluded to by the other partners who have spoken this morning about how this is a crisis within a crisis. And it shows that there are systemic issues that are being, they're just laying bare how this is going to disproportionately affect certain communities. And what's been the hardest thing for me to see is that, and to realize, is that it didn't have to be this way. You know, like we could have had clean, safe water for everybody. We could have had affordable housing for everybody. We could have had access to testing and treatment options for more people. And I think it's those policies and those decisions that have been generations in the making that are driving the current circumstances that we face today.
No, Dr. Broad, thank you for that. I mean, it's sort of what I studied in medical school and graduate school as well, right? The social determinants of health, sort of taking on this not only holistic, but historical, what you talk about, it's like the nesting doll phenomenon, right? A crisis within a crisis within a crisis. You spend a lot of your time thinking about health workforce shortage, data collection issues as well, and how lack of data can lead to invisibility. Can you dig in for us a little bit on that, Dr. Broad?
Well, as far as the health workforce issue, you know, in the tribal health system, which is going to be urban Indian health, sovereign tribal health clinics, but then also the Indian Health Service, we have a real challenge identifying the health workforce shortages that are out there. In our region, we actually just launched this month the first known tribal health workforce survey that's inclusive of all of the constituencies within the tribal health system and not siloed out. And when you look at these issues like access to care, right? Places in the Great Plains or out here in the Pacific Northwest, we may have some of the most beautiful, expensive facilities from the outside, right? Where you have spent a lot of money and created jobs to build this facility, yet if you can't staff it, and if you don't have any doctors, for instance, if you've built a large hospital that's supposed to serve tribal people, yet your ICU isn't staffed and it becomes a storage facility, how is that going to help the people? Or if you have a large or a really well-built primary care clinic, but you don't have any doctors that work there, right, how are you going to provide the care to people that are there? And I think those are the elements that can be tough when you're looking at lack or paucity of data around whether it's the invisibility of Indigenous people when it comes to having COVID, being admitted to a hospital, death rates, et cetera. The tribes have actually been doing tremendous work in the tribal epidemiology centers to correct the data and make sure that we are seen in the data. But then as well, from the workforce standpoint, if people don't even know the challenges that exist, how can we address them at a policy level? And so that's what we're really trying to do out here, is have an accurate, realistic picture of what the shortages are so we can do something about it.
Appreciate that, and appreciate you sort of this notion of data justice that is so critical to getting beyond this. You know, it was interesting when we talked and I got to meet you, Dr. Brodt. I was struck by something you said, where you said, you know, pandemics aren't new to us. Can you talk about how you contextualize this moment, this storm that we're all navigating through?
I think, you know, as COVID has gone on, you know, my wife and I, we live here in Portland, Oregon. We're both from tribal communities, and we plant a traditional garden in our yard, and we grow those medicines and we grow those foods that we eat, and we still practice those ways. And it hasn't been lost on me that our communities have faced tremendous challenges in the past, whether it's been colonization, whether it's been, you know, acts of genocide, or whether it's been epidemics and pandemics. And people kept leaning in and thinking of us then so that we could be surviving now. They continued to plant those foods and those medicines. And those are things that I draw strength from, knowing that somebody kept doing that work and kept believing in those ways, thinking of us in a positive way for the future. And as I look at like my own family story, you know, in the 19 teens, like my family, there are 5 people of 7 that died during an epidemic in northern Minnesota. And these are stories that have been carried forward, and we have not forgotten them. And so COVID in that sense has also been a painful reminder of the things that our ancestors went through, and it really wasn't that long ago. So those are the ways I think of that, and that's how I contextualize it personally.
I appreciate that so much, Dr. Brodt. I'm sorry again, this rich conversation that we simply don't have enough time for, but I will ask our audience. I thoroughly enjoyed getting to spend some time on the We Are the Healers website that shares your story and your leadership example as a clinician, as a tribal health leader. So appreciate that and appreciate you, and looking forward to continuing in the Q&A session. So thank you, Dr. Brodt. Now I'm going to turn to Khalil Cumberbatch. Khalil, you know, while mistakes are inevitable in the face of such a massive and rapidly evolving domestic and global challenge, I think it is clear that our federal government's and some state governments' responses to the pandemic are marked by massive failures in judgment and inaction. And these failures obviously land most heavily on vulnerable and marginalized populations, including incarcerated citizens. And for example, you know, we know that the 5 largest outbreaks in the country are linked to correctional facilities. You're a senior fellow at the Council on Criminal Justice, which launched the National Commission on COVID-19 and Criminal Justice. Can you first walk us through the genesis of the commission? Why was it set up? Who's on the commission? And some of your key findings on the impact of COVID-19 on incarcerated citizens in the criminal justice system.
Thank you, Cheryl, and thank you to the staff at Skoll, Jimmy Briggs in particular, for organizing this amazing event, and his team for making it extremely easy to be here. The National Commission on COVID-19 and the Criminal Justice System was established by the Council on Criminal Justice. The Council on Criminal Justice is a think tank and a membership organization that was founded last year by Adam Gelb. Much like the Council on Foreign Relations, the Council aims to create a new center of gravity for fact-based, evidence-informed criminal justice conversations. The Council launched the commission because, frankly, no one else had. There needed to be a serious, nonpartisan national conversation on how the criminal justice system was going to respond to COVID-19. And so the Council stepped in and stepped up to fill the void. The commission is led and co-chaired by 2 former attorney generals, Loretta Lynch and Alberto Gonzalez, along with 11 other leaders from the criminal justice area who bring various perspectives, including public health and public safety. In addition, my colleague Thomas App serves as the director of the commission. And last month, the commission released its recommendations for response and future readiness, offering a series of broad and overlapping recommendations, as well as a series of sector-specific recommendations covering the sectors of courts, corrections, community-based organizations, and policing. To that end, here are a few of the major recommendations the Commission has already made. One is to go beyond the CDC guidance to stop exponential growth of COVID-19 within the criminal justice system, essentially making the CDC guidance the floor as opposed to the ceiling. Communicate transparently about COVID-19 response plans, policies, and more importantly, and to some extent of the utmost importance, data. As Dr. Bassett mentioned, data is something that is very little and is hard to come by, especially from major corrections agencies all across the country. Third, adopt universal masking requirements for all staff and impacted populations when indoors and in close contact with others. 4, widely and frequently test staff and justice-involved populations for COVID-19 using the most reliable methods available. 5th, limit contact and maximize distance and reduce density. As we all know, density is one of the major factors that COVID-19 plays on to accelerate its spread. And last, but certainly not least, to actively engage and consider impacted communities in all decision-making processes. There's a link in the chat for folks to check out the full report, and we hope that that you'll read it to learn a little bit more. Moving forward, the Commission will be releasing more recommendations in December, and these recommendations will be focusing more on systemic issues, looking to capitalize on the lessons learned and to really try to envision a post-pandemic criminal justice system that is way more better aligned with public health and public safety than the current one that we have.
Thank you, Khalil. Can I ask, has the current administration and even agencies at the state and local level, have they been receptive and have any of the recommendations you just laid out for us been adopted and implemented?
Yeah, we've been sharing our report and its findings and its recommendations widely with quite literally any and everyone. It's a key role of myself and one of my colleagues, Andrew Page. To our knowledge, so far we don't know of any entities that have implemented any of the recommendations that we laid forth in the report. However, you know, it's extremely difficult to get states and localities all on the same page, and especially with the absence of strong federal leadership. And so, you know, more importantly, what we would hope is that those entities are focusing on producing and reporting data that would help to give us a better idea of what the best practices are. And unfortunately, we don't see that right now.
Right. So, you know, I was talking a couple of weeks ago, I'm looking in this moment, Khalil, for bright spots, right? So I was talking a couple of weeks ago with a Echoing Green fellow Echoing Green fellow, Van Jones, and, you know, he's with Reform Alliance, and he was sort of giving me an update on the Alliance's SAFER Plan acronym, which sort of talks about many of the recommendations that your organization laid out. But in particular, he was talking about the push and success around releasing elderly and the vulnerable to home confinement, right? Just to get them out of those dense spaces, as you said. Can you talk about any other bright spots that you're saying, right? The grassroots energy around protecting our fellow incarcerated citizens?
Yeah, sure. I mean, I think one of the silver linings, if we can call it that came out of the way that COVID-19 just completely ravaged the criminal justice system is that we are seeing municipalities, states, and to some extent the federal government do exactly what many advocates were calling for in some cases for decades, which is essentially to rapidly decarcerate or to deconcentrate the criminal justice system. And so one of the ways of doing that is the one that you mentioned, that Van and Reform Alliance had laid out. But there are many more, particularly in the pretrial phase of a person's involvement in the criminal justice system. And for those who may not be aware, pretrial is essentially the phase where a person is legally innocent, as we all have the legal and constitutional right to be viewed as innocent before guilty. And we've seen some municipalities drop their jail population by 50% in a matter of months. And this is a notion that those same municipalities and many across the country said were almost impossible. And it was it was due largely because of the grassroots efforts that were largely putting those options in front of those municipalities and those states, again, for sometimes decades before we actually saw it done over the course of the months from March until, to some extent, August.
That's extraordinarily important. Really appreciate you raising that, Khalil. I wish we had more time. This is such an important topic, but appreciate you dropping in the study with recommendations, and we'll look forward to hearing more about what the council is up to. So thank you so much for that. Now I'm going to turn to our next speaker, Sonia Perez, who is COO of Unidos US, formerly National Council of La Raza. Unidos US is the nation's largest Latino civil rights and advocacy organization. Sonia, you sit on top of an extraordinary network, and you are seeing and hearing a lot, as well as doing a lot. Can you talk to us about the disparate impact of COVID-19 on Latinos in the US?
Yes, absolutely. And thank you again for Cheryl for this conversation, to Skoll, to all the panelists. It's really powerful for all of us to come together. And I know we feel a tremendous responsibility for the communities that we serve, and for creating the kind of world we want to live in and ensuring equity among these communities. So this is work Unidos US has been doing for more than 5 decades, and really having seeing firsthand, right, the structural inequalities across issues, right? It isn't just about health, it's housing, it's economic and employment opportunities, it's education. So we are not surprised, frankly, at having seen the impact of COVID on the Latino community. We're about 19% of the US population, and yet about 37% of COVID cases nationwide are among Latinos, among children. In particular, it's a huge concern because of, we're seeing deaths among children age 5 to 17 among Latino children, again, facing COVID. It's about 37% of deaths among children are Latino. So, we're seeing the implications on this population, which is critical. It's not just for the Latino population, it's for the country, right? We're a young population. We're about 1 in 5 Americans. So the future of the country really rests on the economic and well-being of Latinos. And I would say that, that the community-based network in particular that we work with affiliates across the country and in Puerto Rico, and we should talk about Puerto Rico and the experience of COVID there as well. But these are organizations that are serving on the front lines, really have the experience of seeing how COVID is affecting our community, and also have pivoted to be able to provide services and do what is needed in the absence of a federal coordinated response.
I'd love to dig into that, if you don't mind, Sonia. I know that you have such a broad network, hundreds and hundreds of organizations that are part of your national network. And as you look across the country, can you share some place-based examples of how civic organizations are standing in the breach, whether at the border, middle of the country, big urban areas? Would love to hear some bright spots, Sonia.
Sure. Well, I do think that one of the lessons we've learned is from listening to these organizations, listening to our affiliate network and understanding what they're seeing, but also using that information to shape our responses. So for example, they talked very early on about the need for many more resources for the community. So we did set up an Esperanza Hope Fund, as we called it, to do a focus on public health messaging, for example, in dual language. And I would refer folks to our website, unidosus.org. We do have a toolkit and a bunch of materials, again, developed in coordination with these organizations, specifically around messaging that works for the Latino community, right? So using the resources of the Hope Fund to do public health messaging and to target the community, to support these organizations with resources for them to provide cash assistance, to do emergency relief, to pivot from what they were doing to then now provide food banks and to provide health services and testing, et cetera, and also to do national advocacy, right? So using the information that we learned and listening to them, learning from them, being able to elevate their stories and what they've done. So for example, in Chicago, on the south side of Chicago, Esperanza Health Centers very early on used a data-based and driven approach, which we all hear is critical to solving this problem. And understanding, taking a particular community where they were working, tracking the positivity rate, and doing testing in order to reduce the positivity rate and communicating that to the community, right? This is the science and the knowledge and the facts that we have can be translated so that everybody can understand what it means and how they can protect themselves. You provide the information, communities will protect themselves. This same organization is now engaged in educating and informing the community about the importance of vaccine trials. So, that's just one example of one small community. I would also point to Reading, Pennsylvania as another place where some innovative leadership was taking place with one of our affiliate executive directors who reached out to us to share the concern about the fact that kids are being remote learning is happening, and yet in Reading, Pennsylvania, 90% of the kids in that school district are Latino, and yet did not have access to the internet, did not have the digital devices. They know, this organization, the Hispanic Center of Reading, knows that we work with Comcast. So we coordinated a conversation between Comcast, Reading, the Reading School District, and this affiliate. And as a result, they were able to do an agreement to ensure that 10,000 students have now access to the internet and to these devices. So there are ways that you can address the local issues by listening to what's happening at the community, but also looking for opportunities for partnership, right? It isn't just about one organization or one entity or one sector addressing this. It's really all of us coming together. And I think we're seeing that clearly from the examples in these communities.
No, I so appreciate you raising that up. Sort of the sine qua non of social innovation is sort of this alliance-based model for change, right? Bringing together partnerships and collaborations that drive change. So appreciate that. Don't have a lot of time left, Sonia, but given just the import of the work and leadership of Unidos US, can you talk about how this crisis, the pandemic, has sort of shaped the organization's thinking around equity considerations? Has it changed your policy agenda, your organizing? I'm just curious how you all are navigating this moment.
Yeah, I think this is the moment. I mean, this year we're all experiencing this, the refocus and importance of elevating conversations around racism, around racial injustice, around structural racism and inequities that we've been working on these issues for more than 5 decades. And it isn't just happening in one place, it's happening across different issues. And we can, I think, take this moment and this opportunity to expand the conversation about what does it mean that we're a nation that's changing, demographics are changing, that we need to think about how racism affects different communities of color. And also in the case of Latinos, again, because of the size of the population, 20% of the population of the US population is Latino, young population, the future of our country in terms of workers and taxpayers. So we need to broaden the conversation to think about what does it mean for this community? And really, once we're looking at issues of equity, it isn't just affecting our communities of color, it's about creating the country that we want and how we all benefit from that.
No, so appreciate that, Sonia. Never has that felt more important than in this moment, on this day, when we're looking to election day, just a few short days from now. So appreciate those remarks. Thank you so much. I'm going to turn to the last speaker in this segment, Cynthia Choi. Hi, Cynthia. I have to say I've known of and followed your work at Chinese for Affirmative Action because your co-executive director, Vincent Pan, is an Echoing Green alum. So have long appreciated your work. And I also know that long before the pandemic, you all were organizing the Chinese American community to participate in mass rallies and vigils in response to rising xenophobia and white nationalism in San Francisco's Chinatown. Can you talk about this moment, which is not at all new for your constituents, but magnified and complicated by the impacts of this disease?
Thank you, Cheryl, and thanks for this opportunity to talk about the disparate impact on the Asian American community. So as the panelists have, articulated well, I think COVID has really exposed the pre-existing condition of structural racism, and how that's played out in our community is the fact that there has been a surge in anti-Asian racism and xenophobic that's manifested in attacks against our community. So in the same ways that our community has been impacted, has had health impacts, disparate economic impacts. Here in San Francisco, over 50% of the deaths are Asian. We also see that with Asian American workers and in the labor force, because that they are, working in the hospitality industry, retail and so forth, that they're not only losing their jobs, but they are also facing discrimination and being attacked while being essential workers. But with regard to our work with our partners, we started Stop API Hate with AppCon based in Los Angeles and SF State University. We came together because we knew that the backlash would be severe. This isn't anything new, as you pointed out. It actually defines our experience as Asians, as immigrants here, where we have been blamed for economic crisis, public health crisis, and of course, whenever there's any kind of US foreign relations issue. And just imagine all three of these things coming together. So it's the trifecta. And what's that resulted in is we've had 2,700 incidents that have come onto our reporting site where individuals, while living out their daily lives, have been verbally attacked, physically attacked, and encountered discrimination in the workplace and in private businesses. And we did this because we wanted to, number one, have it be taken seriously. So we have been able to do that, to make a case. We also wanted to make sure that the response to it was appropriate. So there's been a huge focus on policing and hate crimes. We think that that's the wrong direction. We actually want to promote practices that will not cause further harm, will not further criminalize. And in fact, we want to focus on community-based efforts that really address safety and justice and the root causes of violence in our community. And I'm very inspired by the fact that this is happening not just here in California, but throughout the country.
So appreciate that. And can you talk a little bit in regards to the Stop API Hate campaign, how that intersects, works in alliance with groups like Black Lives Matter to advance the cause of racial equity more generally? Where are the overlaps there, Cynthia?
We think it's inextricably tied. Our work is rooted in the recognition that Black, Indigenous, people of color, and immigrants, we need to work together and in solidarity, which is why I think we've worked very hard to actually point to the racist rhetoric, white supremacy, and the fact that we have over 400 anti-immigrant policies that have been enacted under the Trump administration. Many of you know about the more familiar ones, like the trying to end DACA, the Muslim ban. What we're trying to do is educate our own community about the history of white supremacy, the history of policing in the United States. And this is the work that many organizations, as I said, including ours, are working to educate our community who may not be familiar with those civil rights history and the fact that there is a racial hierarchy, colorism, and this is all work that we need to dismantle together.
No, so appreciate that, sort of the reference to, game-changing works like Isabel Wilkerson's Caste. Sort of the history of racial violence is broad. I'm thinking back to the anti-Chinese riots, the Rock Springs Massacre, forced evacuations in the Pacific Northwest in the 19th century. This is as old as our country, Cynthia. And how do you align sort of the energy of things like Stop API Hate campaign along with this political moment? How do you continue to have that sort of energy and focus and attention on this work that might be heightened during a election season to ensure that it continues after?
Well, we obviously have done a lot to try to engage our community. We have 11 million potential voters from the Asian American community, one of the fastest growing electorates. But we have had a problem with turnout. And so that has been the huge push. And now we have, I think we've seen some statistics about, young people, young voters who are more animated now because of the fact that we are having a racial reckoning. We are connecting the dots to what's happening to us, to other communities of color, and the fact that it's important that we recognize that this is structural racism, it's not new, and that we can actually do something about that. And so regardless of the outcome of the election, our work needs to continue. I just want to remind the fact that in prior Democratic administrations, we were deporting people. There was an effort to criminalize parts of our community. And so I think we have to recognize that whatever the election outcomes, we actually need to build more movements that are doing work within our community as well as across our communities. And that's the energy and what inspires me today.
No, that's beautifully said. So thank you, Cynthia. Perfect moment for me to pause here and to thank you and all of our speakers in this first segment. Thank you for educating us and taking us on this journey. And I'll just say, I'll end where I began. We're in a crisis. We have to name it. We have to own it. I was reminded the official magazine of the NAACP, which has been in continuous publication since 1910, is named The Crisis. And the first editor of that magazine, the great W.E.B. Du Bois, wanted, through the name and the narratives, to convey what a critical moment it was for Black folks in this country, what a dangerous moment it was for them. But the magazine was also an extraordinarily important vehicle for many of the key voices of the Harlem Renaissance. And I will say I've always been really heartened by that trajectory toward inspiration and transformation out of pain and trauma. And I think it really sets up perfectly our next moderator, Jimmy Briggs, a Skoll Foundation principal and journalist whose prose is truly poetry. He's now convened a group of creatives, innovators who are responding to the pandemic, who are drawing from community need and culture, working every day to prevent the pandemic spread and help those impacted by this disease. So I'm really honored to turn it over to you, Jimmy.
Jill, thank you so much for that gracious introduction, and also for your masterful questioning and dialogue with our speakers. For myself, I just want to acknowledge a few people, I guess in-house business, if you will. I think it was Brother Khalil who called me out in his remarks for putting this together, but I have to acknowledge and honor my colleagues within the Skoll Foundation who've been working so tirelessly alongside me to bring this vision to fruition, namely Jessica Flutie, Phil Collis, Claire Wathen, Jill Alton, Robin Belinsky, Sierra Gonzalez, and Norma Rodriguez, along with Teresa Chin. And also thank you, Don Gibbs, our CEO, for giving the green light to do this pilot town hall and your affirmation of the vision and learning agenda we want to build from it. I have to, as Cheryl notes, we are in a moment of crisis, and I feel compelled to, in love, as Tulane pointed out the need for love, hold up the families of Walter Wallace and Karan Hilton Brown, who are suffering in Philadelphia and DC as we speak. And I also really want to send prayers and affirmation to Washington, DC and Philadelphia in the midst of uprisings in response to the murders of those gentlemen, as well as our fallen sister, Breonna Taylor, who herself was a frontline activist in the midst of COVID-19, whose life was taken. I want to introduce our discussants and being mindful of time. I want to introduce them, allow them the opportunity to speak about their respective work and impact they're seeing, and the impact of COVID-19, but also the impact of their words and actions they're having in response to COVID-19, and then bring both groups together as a whole, so we can percolate the responses and questions that are popcorning in the chat now. First, I want to introduce Ernest Boykin, who is a criminal justice reform advocate and works in partnership with Families Against Mandatory Minimums. We also have Kim Galan, associate professor of history at Purdue University and the founder of COVID Black, as well as Nathaniel Smith, founder and chief equity officer of the Partnership for Southern Equity in Atlanta, Georgia. Then we have Monique Tula, who is executive director for the National Harm Reduction Coalition. And finally, Dr. Olajide Williams, who is professor of neurology at Columbia University and the founder of Hip Hop Public Health. My first question will be directed towards Ernest Boykin. Brother Ernest, you heard Khalil Cumberbatch from the Council on Criminal Justice speak about the impact of COVID-19 on incarceration and the criminal justice system. I was hoping, Ernest, you could briefly share your perspective of what those who are currently incarcerated in the midst of the COVID-19 pandemic are experiencing, and what the journey home is like coming back to one's home community that is debilitated, sometimes even more deeply, not only by systemic racism, but now by the pandemic.
Hey, hello, good. I'd like to say thank you to Jimmy and Skoll Foundation, and thank you to the panel. And you know, my heart goes out to the young man, Karan. I actually live in the same neighborhood as he does. That's right down the street. He was killed on 7th and Kennedy Street Northwest. I live on 14th and Kennedy. So that really hits home. I've seen the protest, and it's terrible. But back to what you said, Jimmy. Basically, I didn't understand at first why I was selected for this panel. However, once I listened to everybody and Jimmy brought me up to speed, I feel like I can really add a great perspective, because I was a recipient of compassionate release on July the 17th. And most people who were incarcerated or in that situation, a lot of people don't have the ability to articulate themselves and speak about what they went through or what they're going through. So I want to be that voice for the people who can't speak for themselves, the voiceless. Coming home from prison is like, just to put you in perspective, imagine being in a coma and then you sleep for 2 years, a year, however long you're in that coma, and then you wake up. You come home and there's new buildings, there's new people that live in your neighborhood, kids have grown up, like it's like a shock. And that's the same thing that a person coming home from prison experiences on a normal day. You know, they understand that they come home from prison, nothing's gonna be the same, especially if they've been in there for a year, 5 years, 10 years, 20 years, 30 years. However, during the midst of this COVID, for everybody to understand what a person is going through, just put yourself in a position like you were in a coma and you come out. Now you see everybody with masks on. You're basically thinking you're free from prison, but you're going back in the house to be locked down. So you can't move around like you want. The processes are slowed down. The DMV is slowed down, so you can't get an ID. So without an ID, you can't really have health care. You can't drive. You can't do anything without an ID. So things like that have been impeded by this COVID process. Not only the systems, but now you can't see your family members or your loved ones that you've missed over this period of time that you've been absent. And you know, I look at it as a good and a bad thing, you know, because that's the type of person I am. I always can find the good in a situation. Being that COVID has struck, there are a lot of opportunities for returning citizens to gain employment now. There's a lot of jobs that people don't want to take because of COVID. So now there are opportunities for people who want to better themselves to go back to work. There's also opportunity for a person to do online education and things like that. So I can look at the upside, but a lot of people, they don't look at the upside because COVID is affecting minorities. It's affecting the Black, brown community, even the Asian community, a lot differently than it is affecting the white community or the affluent community. I live in a community, like I said, I live on 14th and Kennedy Street, and all the houses around me are pretty big houses and we're right across from Rock Creek Park, the famous Rock Creek Park. But if you go down the street, 3 blocks. This is where the gentleman was killed by the cops. They chased him on a moped, and which is supposed to be against policy, and he was murdered. So there's all kinds of poverty. The line is really thin, but it's a big gap. It's a huge gap, and this is the difference. What the white community is experiencing one COVID, and the poor people, the Blacks, the browns, and even the Asians who are being discriminated against because they're calling it the China virus. you know, they're experiencing a whole nother COVID. My neighbors, who are, most of them are white, they're in their gardens, they're with their kids, they're with their dogs, they're buying new things because they have money. You know, some of them are executives, and they're taking down huge salaries from home, and they're enjoying themselves. They're enjoying this pandemic, even though they can't go out, but they still have the opportunity to order Ruth Chris to the house. They can go to the grocery store and buy crab legs and seafood and have a good old time. But then the people in the poor communities, the people who have just returned from prison, they are actually having a really tough time. They are really trying to struggle how to make ends meet, and trying to figure out, you know, goodness gracious, Lysol is $5 a can, and then now I have to do this, and I got to get on the bus with people sneezing and coughing. You got to get on the back of the bus in DC. It's free now. Yes, it's free. However, you got to get on the back of the bus, and the symbolism in just getting on the back of the bus for a Black person is terrible. This is what Black people had to do, get on the back of the bus. And now they have to do it again because of COVID.
Thank you so much, Ernest. Thank you for that perspective, that badly needed perspective. I want to go to Dr. Williams at Columbia University about public health. Dr. Williams, we heard previously from several speakers about the need for communications and narrative. And from your perspective, I'm curious. I mean, through hip hop public health, you are working to create culturally resonant messaging, behavioral health messaging, particularly for Black and Latinx populations. And I'm wondering, you know, as a physician, public health specialist, can you speak to the work of hip hop public health, but also the critical need for messaging that reaches the communities that need to be served the most?
Sure. First of all, I just want to thank you, Jimmy, for putting this together, and the entire Skoll team. So, you know, hip hop public health, we recognize the challenge of behavior change and the myriad structural barriers that are often tied to social determinants of health, and require more complex solutions. But we believe that we need to get to a place where healthy behavior needs to become the easiest behavior, or the default behavior, from an environmental, cognitive, and emotional perspective. The environmental structural challenges, some of whom Dr. Bassett has discussed, and other panelists have spoken about so eloquently, are outside of hip hop public health's mission. And what we try to do is address the powerful cognitive and emotional components of behavior change within Black communities, where we've been building trust over more than a decade. So we do this by addressing behavior change through a model we developed that kind of operationalizes a culturally tailored health education approach that uses hip hop across the socio-ecological levels of behavioral influence. And we focus almost exclusively on youth of color. You know, we recognize that many of our constituents are in what we call the pre-contemplation stage of behavior change, given the hardships that they endure and the social deprivation that surrounds them. We try to practically target specific components of actionable knowledge, as well as behavioral skills and self-efficacy, in a way that emotionally connects with them. It's culturally adapted to their lifestyles and is cool and relevant. We've done this with our COVID prevention media. We've done this with things like mindfulness resources. You know, I personally believe one of the next waves, one of the next epidemics that we're going to see in communities of color is one that's been brewing for a long time, and it's about to explode. And that's the epidemic of trauma and post-traumatic stress disorder. And I think that really developing structures around those issues, as well as the type of culturally tailored and adapted and emotionally connecting messages that they need, is going to be critical for moving forward.
Thank you so much for the analysis, Dr. Williams. I want to go to Monique Tula at the National Harm Reduction Coalition. And Monique, who and I know each other, and Cynthia earlier spoke about the trifecta at this moment. But it's more than a trifecta, because as you know, Monique, the country has, before COVID, been facing an overdose crisis around fentanyl and heroin usage, particularly in the white community. I'm curious, from your point of view in Oakland, but working nationally, if you could just provide us a glimpse into what you're seeing, how this pandemic has impacted the community of people, impacted the harm reduction community, its ability to deliver the resources and information needed to keep people alive, but also how it's impacted, I would say, the view of people who are in the harm reduction community and using drugs. I ask that question because I live in New York City, and I hear neighbors and colleagues complain about the increase of the homeless population, or complain about individuals being moved into hotels rather than being on the streets. I'm just curious, from your point of view, what are you seeing, and how is the organization combating the stigma, combating the challenge, the increased challenge for resources?
Well, thank you, Jimmy. It's an honor to be here with all of these social justice warriors, for real. And I just want to thank you, also commend your leadership for bringing, this important topic to the forefront of Skoll's work. Greetings from chilly Los Angeles, and there's some folks outside doing some work, so let's pray they don't get started before you cut my mic. Let me just tell you a little bit about harm reduction, because maybe some of your audience aren't familiar with it. The emergence of harm reduction was in direct response to the lack of attention and political will to address the raging HIV/AIDS epidemic among people who use drugs in the 80s. So the founders of harm reduction in the US were what I call a group of radical badasses, to be honest with you. They were activists and community organizers. There were some researchers, social workers, and people who use drugs themselves. And they all made the bold decision to care about people who use drugs who were dying from AIDS. So there's 6 principles of harm reduction. There's health and dignity. So the right to be healthy and seen as a whole person, participant-centered services, so meeting people where they are, rather than where we want them to be, participant involvement in the design and services for them, participant autonomy, social cultural competency, and then just pragmatism and realism. So we do not ignore or minimize the very real and potential tragic harms that are associated with substance use. So I can't talk, nobody here can talk about health disparities, and in my case, among people who use drugs, or the overdose crisis or racial equity, without naming front and center white supremacy, which is what sustains the conditions under which Black and brown and poor folks of all colors struggle to survive, much less thrive, right? So white colonizers stole land that was inhabited by indigenous folks, not just here, but all over the planet. There isn't a continent that hasn't been marred by the bloody footprint of colonialism. So those of us who are demanding racial and economic justice, we have a long road ahead of us to change the policies that keeps the white foot quite literally on the necks of Black and brown people. And it's taken us centuries to get here. But the war on drugs rages on, and we know that it's not enough to change policy. Good policies are only as good as the people who practice them. So it's the quality of our interactions that needs to change, and that is what harm reduction is all about. Syringe service programs are an example of a harm reduction public health strategy. And they're considered essential services, although that's not always recognized in some of the jurisdictions around the country. And in fact, in a recent survey on the impact of COVID-19 on syringe service programs in the US, nearly all of the respondents noted that policymakers and leaders didn't include syringe service programs in jurisdictional emergency planning and response. And that is essentially the erasure of people who use drugs. But despite that erasure, demand for services is still high, and in response, staff of syringe service programs have remained open. They've maximized safety, by reinforcing social distancing, minimizing the number of visits. And our organization, we stepped into immediate action in response to COVID-19. We co-created resources, formed mutual aid support groups for folks who are doing harm reduction work all over the country. Some of the resources that we created includes using more safely during COVID. And in fact, COVID actually goes against overdose prevention, risk reduction strategy. So we say don't use alone. COVID says you need to socially distance, and in some cases you have to socially isolate. All of our materials, many of the materials that we've created have been translated into Spanish and now some into Portuguese and Arabic, because we recognize that it's not an exclusive group, racially limited, heterogeneous group of people who use drugs that cuts across all races, right? And I guess I would just also, like many of my co-panelists and the discussants have been saying, COVID, has really exposed some of the structural violence that we've all been living under. I was on a call recently with a number of executive directors of harm reduction programs around the country. And one of our colleagues on the call said something that was particularly profound. She said, syringe service programs can help keep people alive just long enough for them to get COVID. And I felt like that was really profound. It was gruesome, but for many, it's not untrue.
Thank you so much, Monique, for giving us that overarching frame of white supremacy and the historical racism the country has lived under for centuries. I want to go to Nathaniel Smith from Partnership for Southern Equity, based in Atlanta, Georgia. Nathaniel, you through Partnership for Southern Equity have created a COVID-19 fund to support individuals in the regional Southeast of the United States grappling with the economic and health and housing impacts of the virus. I'm hoping you can give us a glimpse what you're seeing from a regional perspective and how the tenor, if you will, in terms of both the official state response, local response is playing out, as well as how successful your efforts have been at Partnership for Southern Equity to mitigate the harshest consequences of the pandemic.
Well, Jimmy, again, I can't say enough how appreciative I am of this opportunity, and just thank you so much in the Skoll Foundation for giving someone from the American South an opportunity to participate in this conversation. A lot of times the South is forgotten in key conversations like this. And as an organization like the Partnership for Southern Equity that believes that the road to true liberation must go through the South, it is critical to always provide opportunities for our voices to be heard. PSC is just a nonprofit organization, a racial equity organization that is working to advance a new Southern agenda for racial equity and shared prosperity in the American South. And I would say, Jimmy, that in order for us to move forward and talk about where we are, we also have to talk about where we've been. James Baldwin talked a great deal about how history is the present, and we have to understand that in many ways. I've heard a lot of people talk about on this panel, which I'm just honored to be a part of, about the social determinants of health. And one of the things that we know and understand now more than ever is that racism is a social determinant. And not only is racism a social determinant, but it is the social determinant for communities of color and Black folks. And in many ways, we believe the number one killer, not COVID or other diseases or viruses, the number one killer for Black people and communities of color in this nation. We also have to understand within the context of our economy and why the South is so important, that you had a region that built its economy off of free labor, the backs of slaves. And in many ways, that relationship between hardworking people who have been exploited by an extractive economy continues to perpetuate itself today. And we saw that in real time through COVID-19, where where low-skilled labor became essential workers within the context of the lexicon of our economy. And what happens when we create an economy that is built exclusively on extraction and exploitation, and how that moves us towards a bankruptcy of empathy, is where we are. And I think in many ways, COVID-19 has shown us that. For the Partnership for Southern Equity, we also understood, and this is really what I wanted to get to, Jimmy, to answer your question, is that you cannot continue to put good money in bad systems and expect good results. And that was one of the reasons why we decided to create a COVID-19 emergency fund, because although we had a philanthropic ecosystem, we knew that it was influenced in many ways by structural racism and privilege and white supremacy. So we wanted to create an alternative way to get money to Black-led organizations on the ground with minimal budgets, because they are the closest to the people who need the money the most. And from that experience, we've seen the resilience and the commitment of frontline organizations in being involved in shaping their own destiny. One of our partners, Gloria Walton, who's the CEO of Solution Project, talks a great deal about how we need leaders from communities right now. And we also believe that the people that are closest to the solution, closest to the problem, are actually closest to the solution. And that's why I really appreciated Ernest's comments about what he's seeing on the ground, because that is where we believe the answers are. And so for us, we believe that this is not just about COVID. It's about systems of extraction and oppression. It's about creating alternative economies that are healing and not extractive. It's about understanding the history of the stripping of humanity and its role in creating an economy that is not healing. And we have to find a way to move forward to create an economy that looks at everyone as an asset and no one as a liability.
Thank you so much, Nathaniel. Wow, thank you so much for your analysis and framing, and especially the call out of the donor community and supporting what works. Finally, I want to go to Kim Gallon at Purdue University, the founder of COVID Black, the co-founder with Esther Armah and Accra, Ghana. Esther's with the Armah Institute for Emotional Justice. She's working with Kim on the Black Frontline, which is an oral history project to center and elevate the voices of Black healthcare workers in the front line in the midst of COVID in Ghana, the UK, and the United States. Kim, there's been a lot of talk in this conversation from the beginning with Dr. Bassett about data and the necessity of data. And as someone who, data is your wheelhouse. Data, that's your expertise at COVID Black. Can you explain to us? We've heard about the importance of data, but how data, the use of data, and how the misuse of data can also be harmful. I know when we spoke previously several days ago in advance of this conversation, you also mentioned living data. I was hoping you could contextualize that in this conversation.
Thank you, Jimmy. And again, I want to echo on my co-panelists here and thank the Skoll Foundation. Again, Jimmy, particularly you for inviting COVID Black to be a part of this important conversation. COVID Black started in early April with a call and organizing people to call on their local health departments to release the data. Seems like a lifetime ago, but in the early stages of the pandemic, data was really hard to come by on race and ethnicity. And so COVID Black started off with trying to get people on the ground to call on their health departments. Since that time, COVID Black has been evolved into a nonprofit and data analytics firm that looks at Black health data. We work at the intersection of race, health data, information, and social justice. We redefine quantitative data and we turn it into what we call living data and data stories about Black health. And more importantly, and this really touches on what Nathaniel said, Dr. Williams said, what Ernest said, and Tula said, we connect Black communities to their data. So at the heart of what we do is we think about data in a living data sort of way. I'll talk a little bit more about that in a second. But according to the APM Research Lab, their Color Coronavirus Project, project, 1 in 920 Black Americans have died from COVID-19, and that was of October 13th. And what that means, I really want to put that into real full relief. That has meant that multiple people in one family have died. COVID Black has collected the largest data set on Black stories of people that have passed away from COVID-19. And I can tell you that with the collection of the data, I am seeing multiple family members, multiple community members that have passed away. So Dr. Williams' mentioning of trauma and that being the next health crisis is absolutely apt. Now, the color of coronavirus, and Andy Egbert, the Senior Research Associate, is in the audience, and she'll put the link to the homepage into the chat, is incredibly important quantitative data. But what COVID Black does is we turn quantitative data into living data and information about the Black lived experience. And Dr. Williams and I talked a couple days ago, and he and other practitioners in the field want more contextual data, right? And so what COVID Black has done is created an interactive visualization that will go live on December 1st that will allow people to see the different patterns of Black people's lives who have passed away from COVID-19, but more importantly, to give Black communities a way to connect to the loved ones that they've lost by being able to engage in their stories. I'll say one more thing. The next thing that we have to really get on top of is vaccine hesitancy. And COVID Black is gearing up now to start working with communities on the ground, helping them understand their data, being empowered by their data, because we talk about data a lot, but we don't talk about making sure Black communities have that data, making sure people of color have that data, are empowered by it, not alienated by it. So essentially what we do is we recover the lives and the stories of people from the data. We can't do this work without projects like the APM Research Lab, Color of Coronavirus, but COVID Black takes those numbers and turns them into stories. I just want to mention the last,
sorry. Okay. Well, I was going to say thank you so much. We already short on time, Kim, and I apologize to you and everyone, everyone from the first quarter and the second one. I think this speaks to the need for a longer conversation, obviously, but also your responses are so rich and necessary, detailed. I do want, before I transition to Don Gibbs, who will we actually watched the video that was meant to be watched earlier, and Don will close us out. But I wanted to, I'm gonna pull an audible here, if you don't mind. I want to focus a closing question, if you will, for a small number of you. I'm hoping that Nick and Tulane and Cynthia and Dr. Broad can be a part of this. The question I have, and a number of you have echoed it, especially Cynthia and Sonia, in your earlier comments and responses with Cheryl. We've all of you have elevated the I guess the racialization of COVID-19. It was racialized in terms of how the narrative, how it's discussed depending on who the population impacted is being elevated as. It's been racialized in terms of the response. But as non-white Americans in this context, how do we affirm and ensure the visibility of our sisters and brothers from other racial and ethnic groups in this conversation? A lot of the attention at large in the general public, is a very dichotomous one. It's either Black or white. Mm-hmm. But as we've heard over the past, hour plus, it's not just Black and white. It's Latino, it's Asian, it's Indigenous American. It's also Black, but even within that Blackness, there's diversity in that. How do we hold up each other's struggles and ally around each other's respective struggles? In other words, and Cynthia mentioned this, alliance with Black Lives Matter, for example, around hate and extremism directed towards the AAPI community. So that's the question I want to leave for us. How do we move forward from this conversation and allyship and unity? And I would love to hear from Dr. Broad and Nick, especially when you can answer that, but also Sonia and Cynthia.
I could start, and I'd love to hear from others, but one thing that I think we need to really talk about is the role of social media and disinformation campaigns. And that exists within the different Asian communities and the different platforms that they are on, in which they get most of their news and information. And no one is immune, I think, to racist ideology. And this is the work that I think we have to really focus on within our communities. I mentioned this before, that we are part of a network across the country that is planning worst case scenarios of mass violence. We are looking to our allies in the AMEMSA community and learning about what they set up post 9/11. This is a time where Asian Americans have been activated and have been for decades, but it's a time to mobilize in solidarity with our with other communities that are also disproportionately affected. And it's a movement moment. It's also a time to call for more investments in civic engagement organizations, more investments in solidarity work that's so essential to our liberation.
Yeah, I would completely agree and say that I also think it's on each of us. I love this conversation because it is expanding the narrative. It's making a complete narrative of what is happening right now to our country, to all of our communities, and how we can all take a role in harnessing our power to make a different vision for what we want, right? The country has changed, it is changing. But we have a lot of power in this group, a lot of power in our communities that I think comes from these kinds of honest conversations. And it is difficult. They're difficult conversations about expansion. It's not about competition. It's not about one or the other. It is about how we all benefit from equity conversations and from racial justice.
Thank you so
One
much,
thing
Sonia
that's been
and Cynthia.
really powerful here in Portland, Oregon, as the protests and the Black Lives Matter movement has really swelled up in a positive way here. I know a lot of the media shows many of the negative elements of protests and everything. But my wife and I, we live in a predominantly and historically Black and Native community here in North Portland. And just the love and outpouring of inclusion that we've had from our community members has been really powerful, whether it's having a rally of 15,000 people walking down our street here and them being just like, hey, you guys, we want you to open this up in your language with your songs in your ways, and to have people start it like that extension of like love that we're talking about a little bit here, that undertone has been tremendously powerful for us. Because when I'm up at, a large academic health center, talking to colleagues who may or may not, who are predominantly not Black or brown, they're not the ones who are facing the 8 and 9 times death rate that we are in our communities. I don't know anybody in my family who has been touched by this yet. And I can speak and agree and just kind of like hold close and empathize with our Black and brown brothers and sisters, because this is impacting us way differently than other people. And I think that the love that has been shared and extended to us as Indigenous people, knowing that we all rise up through this movement as we work together, that gives me a tremendous amount of hope. And I'm very grateful for this movement and moment that also recognizes many of us in this circumstance.
Thank you so much. Thank you so much, Dr. Broad and Kim and Cynthia and Sonia and all of our panelists and speakers. We are over time slightly. I do want to hand it off to Don Gibbs, our CEO, to close us out and share the video with you. Thank you, all the audience members, for joining us, and look forward to future iterations of this town hall series. Don?
I can't add much to what Eric just said. Just so inspired by all of you in the chat, in the audience, and our speakers, and Jimmy and Cheryl for leading this conversation. I only wish we had 5 more hours. Thank you, everyone, and love that. And let's go make sure everybody votes so that we can change some of these systems. Thank you, everybody.